what are the advantages of laparoscopic surgery over open surgery. So let's start with what we do in an open surgery. In an open surgery, depending upon the site of hernia, a 5 to 10 centimeter incision will be placed. We'll be spreading the tissue, we'll be closing the gap in the muscle, and we'll be placing a mesh over it and we'll be closing it. So just because it is a long incision, we need to place stitches to close it. Because the incision is long, the postoperative pain may be relatively much higher compared to laparoscopic surgery, and because of the pain, the hospital stay may be required for 2 to 3 days depending upon the length of the incision. And after getting discharged from the hospital also, there will be a need of frequent dressings, and once the wound is completely healed, patient need to return to the hospital for stitches removal. Ultimately, it leaves a big scar depending upon the length of the incision in open surgery. When it comes to laparoscopic surgery, what exactly we do in laparoscopic surgery? Laparoscopic surgery is also called as keyhole surgery. We will be placing 3 holes over the abdomen. One hole will be 1 centimeter long and the rest 2 holes will be 0.5 centimeter long. And through this 1 centimeter hole, we'll be placing a camera into the abdomen, and to see what all is happening inside the abdomen, we'll be connecting this camera to a video monitor, and thereby we will be getting a magnified and better clarity vision through the camera. And the rest of the surgery is just like a video game. By seeing the video screen, we'll be completing the rest of the surgery. So what will be the end result of laparoscopic surgery? The incision is small, so we need not close it with the stitches. We can just close it with a skin glue also, kind of Fevicol for closing the skin. We'll be placing something called as a waterproof dressing at the end of the laparoscopic surgery, so that immediately after going home, the patient can have a proper bath with soap and water, because there is no risk of infection, or there is no need for frequent dressings, and there is no need for stitch removal in the future. Just because the incision is small, the postoperative pain also will be less. The patient will be able to walk the same day, patient will be resuming on diet the same day, and immediately after going home, there is no need for bed rest at all. He can walk as much as he can, and he can even climb the stairs. He can climb 3 floors, 4 floors with ease. There won't be any need for bed restriction. And what is the ultimate end result? Cosmetically, it will be hard to recognize even the person has undergone a surgery or not, because such small will be the incision. Return to activity or resuming job will be much faster in patients undergoing laparoscopic surgery compared to patients undergoing open surgery. But the only disadvantage of, or the cons of, when it comes to cons of laparoscopic surgery, just because as we discussed, in open surgery we just need the surgical instruments, but when it comes to laparoscopic surgery, apart from the surgical instruments, it's completely technology based. We need to have a good quality camera, we need to have a good quality monitor for a perfect laparoscopic surgery. So compared to open surgery, laparoscopic surgery, the cost of laparoscopic surgery will be bit on the higher side compared to open surgery. How exactly a laparoscopy course of hospital stay in a laparoscopic hernia surgery will be? So the patient will be generally admitted a day before the surgery or on the morning of surgery. Once patient gets admitted, we need few blood tests apart from ECG, X-ray, if needed echo, for anesthesia purpose, and these test reports may be available in 1.5 to 2 hours after the sample is drawn. Once the report is ready, we can proceed for surgery, and the laparoscopic hernia surgery will be done under general anesthesia. What is general anesthesia? The patient will be completely out of conscious and patient won't be feeling any pain during the surgery. The only and only pain the patient will be experiencing during general anesthesia is during insertion of the cannula injection. And once the cannula is inserted, rest all the medicines will be given through the cannula. Say there won't be any pain while administering anesthesia to the patient, and throughout the surgery he will be just lying like that and he won't be having any pain. And once the surgery is finished, patient will be immediately out of the anesthesia and he will be kept under observation for 1 to 2 hours in the recovery room, and once he is completely conscious enough and once the vitals are all stable, he will be shifted to the room. Post surgery, after 4 hours, once the patient is completely conscious, he will be started on liquid diet on the same day of surgery. There is no need for bed restriction. If he wants to go to the washroom, he can all go by himself right on the day of surgery, and there is no need for any bed rest. Once he is tolerating liquid diet and wall, very next day he can be started on the regular diet, and daycare discharge if the patient wants to get discharged on the same day. If the surgery is performed in the morning, he can get discharged on the same day in the evening or the night, or he can stay for that night and he can get discharged the very next day. But all these applies only in healthy adults. The patient has got multiple cardiac issues or renal issues or lung related, liver related issues. The hospital stay may vary accordingly. But mostly the laparoscopic hernia surgery will be a daycare procedure only.